there was a healthy debate regarding biomarkers versus functional outcome data, and I think the audience was polled about their perspective, and then they were polled continuously throughout the discussion to discern whether or not the other side was convincing them. And I think at the end of the day, we all agreed that biomarkers are incredibly helpful, incredibly useful, and we need to evolve how we're utilizing those, but they must correspond effectively to a functional outcome, especially when we're talking about a neuromuscular disease. This is going to impact the muscular function of our boys with Duchenne muscular dystrophy. And so just increasing dystrophin production or another biomarker is not sufficient for us to say that we have impacted the disease compared to natural history. We really need to make sure that that increase in dystrophin leads to a functional difference in their strength. And I think that we're moving forward in the ability to capture that and demonstrate that connection.
When we're measuring these different clinical aspects and biomarker aspects of the disease, the critical question is, but what does that mean for the person that we're trying to apply it to? And in this disease, it's often a young boy, although it could be a young man or an adult living with dystrophinopathy. So we need to be able to better understand what these actually mean in terms of what's going to happen over these next years of their life. And then also, can we make an intervention that's going to make that different? And what's a realistic expectation of what that intervention is going to be? It means nothing to a family to say, I want to give this treatment to you because the North Star is going to increase by 2 points. That's completely impractical. Of course, they don't know what that assessment means. It does mean something to say, your child is going to walk 3 years longer than they would have in natural history if I do this. So we need to make those comparisons. And this is where it's important to think about what's happening in different aspects of what's happening to the body in this disease and how they parallel each other. Work on how the 6-minute walk test can be correlated to upper extremity function, can be correlated to a pulmonary function test and how someone's breathing, can be correlated to how things are changing in the heart perspective with fibrosis and with echocardiogram or archaeocardiogram or MRI evidence of cardiomyopathy. All of these things need to be able to be interpreted together with the clinician team and then the family to make an informed choice about what we're going to be doing going forward. So this biomarker work is critical and is always evolving and needing even more study and more precision in terms of making sure that we're doing the right thing for each individual where they're at relative to the disease.